Ready? Okay, so this, of course, is the pectoralis major. Okay, and it's coming in and it's attaching. We're going to turn this a little bit. You can see here as we come across, you'll see that the muscles have been removed, so we can see some of the deeper muscles. So like this muscle right here, which would be the supraspinatus, whereas this muscle right here would be the infraspinatus. And we can tell that because there's the spine of the scapula, and then here's where the acromion process would be. Now, if we then look here, we'll see, and it's very convenient that they put numbers on here. You can actually see that it's like 2, 2, 2, and then all of a sudden you get to 4. And it's like, wait, how did that go from 2 to 4? Well, because 3 is here, and 3 and 4 are actually the teres muscles. Here's the major, and here's the minor. And the minor is actually found just underneath the infraspinatus. So that's how you can actually tell that that's a different muscle, because they ruined it with numbers. But whatever. Alright, so if we flip it over this way, you can see here's the subscapularis right here. That's what that is. And again, we got the pectoralis major right there. We have the teres major, which is here. And then we have this muscle right here. And this is actually the latissimus dorsi coming in and actually attaching right at that spot right there. Now, as we look here, we can actually see here is the biceps brachii. So that's it right there. Wonderful. Biceps brachii. And you can actually see that there's 2 heads. There's one coming up and attaching here, and there's another one that's going up and it's going around, and it's literally forming a tendon coming around like that. Now, this one on the more inward medial side is going to be the short head of the biceps brachii, whereas this one on the outside is going to be the long head. So this is going to be the long head right there. Now, the reason you want to find the short head is because right next to the short head, right there, is the coracobrachialis. That's it there, right there. And of course, you can see we have nice blood vessel coming down. We have, of course, the axillary coming down, which then turns into the brachial as it goes inwards. Okay. Now, I'm going to turn this a little bit, and you're going to see here, now we're looking at the triceps brachii, and the triceps brachii has 3 parts. So this right here is actually the long head of the triceps brachii, which can be visible on both the anterior or front view as well as the posterior view. What's important though is to look just below that. So if you look just below the long head, you'll see that there's another part of this muscle coming around like this. See it coming like this, going in like that? That's the medial head of the triceps brachii. So medial head, long head, and then if we flip this over like this, we would actually see the lateral head right here, but we don't because it's missing. But that's okay. Now, this muscle right here is the brachialis. It's coming out like this, and then you would see the brachioradialis coming off of there. And that's what that would be. And then right here would be the anconeus, but we're not going to worry about that right now because we're kind of stopping right here at this point. Okay? Now, let's see. Do I want to talk about these blood vessels here? No, I'll wait until we get into the arm. And I'm not going to ask you about the nerves, so you don't have to worry about the nerves. When we do the upper extremity, that's when we'll actually get into that. So don't worry about that right now. All right, that's it.